Welcome to It Starts Within, a podcast from Platinum Performance, where we'll dive into the health challenges faced by veterinarians and horse owners alike. Join us for inspiring stories about the latest advancements in equine care, treatments, and comebacks. You'll hear interviews with elite competitors, innovative researchers, and the veterinarians that devote their lives to horses and the humans that love them. At Platinum Performance, we know the power of nutrition starts within. Hello, all, and welcome to the podcast. I'm Jessie Bengoa, and today we're bringing you a topic that I'm really excited to discuss because whether you're a rider or you're a veterinarian, there's one very nuanced area of the horse's anatomy that takes a lot of teamwork and a very healthy dose of preventative maintenance and some careful management to ensure that the horse stays sound and stays healthy for the long haul. And that is the hoof. And we've certainly been guilty of using the old adage, no hoof, no horse. And while it may sound a little cliche, don't judge, it's true. You know, without healthy feet, the horse can literally and figuratively be in a world of hurt. And we certainly know that as humans, we've experienced that with our own mobility. When your feet hurt, life is not good. And it's the same for the horse. So today, we're going to dig into the most common conditions that both equine veterinarians and farriers see. We're bringing you the veterinary perspective from Dr. Matt Durham. And as most of you know who have heard Dr. Durham in the past, he is a board-certified sports medicine and rehabilitation veterinarian. He's got over 20 years in clinical practice treating high-level sport horses. And I'm now exceedingly lucky to call him a friend and a colleague here at Platinum. And to deliver a dose of perspective from a farrier's point of view is our good friend, Certified Journeyman Farrier and owner of Olsen Equine in Weatherford, Texas, Lee Olsen. Hello, gentlemen. Thank you for joining me.
Hi, Jessie.
Hello.
Thanks for having us.
You bet.
Yeah.
Well, you can blame yourselves because when you do really good on the podcast and people love listening to you, as do I, then you get invited back again and again and again. So welcome back. Congratulations. You're really liked. So we'll do it one more time. And I did recently just get to see these gentlemen for a very in-depth podcast and article in Platinum Magazine on navicular syndrome. So I encourage you to check that out because they really gave us a start to finish deep dive on that condition. And we'll touch on that today, but we really do go deep in that particular episode. So check that out. And you know, something that not a lot of people know about Dr. Durham, actually, he attended farrier school prior to becoming a veterinarian. So he has a special perspective here and kind of dips a toe in both waters of equine veterinary medicine and also has a pretty deep understanding from a farriery perspective as well. And Lee is a competitive horseman himself. So he not only tackles tough cases through Olsen Equine, but he lives this as a horse owner as well. So let's let these guys run wild, shall we? And we are going to touch on several conditions today, but we have a few very specific ones that a lot of us deal with, you know, with our horses. We've seen them once, if not quite a few times throughout our riding careers. And we're going to hit it right now. So first up, let's talk about one that nearly every rider and definitely every veterinarian sees, and that's abscesses. And you know, kind of from the outside looking in as a rider, they sound so simple. They're a pain to deal with for the horse and for the rider. And they sound simple on surface level, but there's a bit more to abscesses than we may know. And Dr. Durham, I'd love it if you would explain abscesses to us and what you're looking out for, managing and also trying to prevent as a veterinarian when it comes to this condition. What say you?
Yeah. This is relatively common, and I'll tell a quick story. There was a kind of a new client to us. She was actually pretty new to horses, and we came out for a really severe lameness. And the horse, you know, didn't want to put any weight on the foot. It had bounding digital pulses. The hoof testers showed there was one area that was extremely sensitive. I found an abscess, and when I told the owner, it was like I'd said, you know, your horse has cancer. And
Oh,
my tech had to say, no, no, this is good. We would never wish it on a horse, but anytime they're that lame, that's exactly what we want it to be because we can fix it. I think one of the things that um, I, I'll be curious to hear Lee's opinion on this, but one of the things that I think happens is there are really kind of two forms of abscess. We could break it down into a million more, but um, if you think of an abscess, like if you've seen pigeon fever or anything like that, an abscess, what it means is that the immune system, the white blood cells and all that, have come in and they've found this area of usually bacteria and they're trying to fight that infection. So some cells die, you get an accumulation of fluid. You know, if it's pigeon fever, then you might lance it. In the hoof, there that true type of abscess can form inside the sensitive tissues, the dermal tissues where the blood vessels and nerves are. And but they can also form outside of the dermal tissues in the insensitive part that where there aren't nerves or anything. But they still create pressure and push on those sensitive areas. Technically, you could argue that those aren't true abscesses because they're not seen as much by the white blood cells and all that. It's more that you have this population of overgrowth of bacteria that have somehow gotten up some little crack and set up shop. You know, they're just growing in that area. The difference sometimes what you'll see with those ones that are true abscesses that are in the dermal or sensitive tissues is that sometimes you'll have swelling that goes all the way up the leg. If you have one that's outside of the dermal tissues, you rarely get swelling in the leg. But I've seen horses where you could swear that the horse had a bowed tendon because they were swollen all the way up the cannon bone, sensitive over the tendons. But in the end, it's an abscess. Those are the ones that are really traveling up the limb. And especially in the hind legs, some of those can turn into a cellulitis that can really turn bad. You'll have these horses where the whole hind limb is swollen all the way up the leg. And those are really tough to deal with. Anyway, ultimately, the what keeps abscesses from forming is a good functioning immune system and good healthy hoof. Um, some of it is, you know, there are lots of risk factors in terms of uh, what they're housed in, if they're standing in a bunch of mud all the time, and also just the quality of the hoof. But in general, once you can get those to drain, you're in pretty good shape. There's some debate about how aggressive you should be in establishing drainage. The guy that I learned from was actually not aggressive because he said if you carve a giant hole, you'll get drainage, but then you have this whole area that's essentially exposed that you need to allow to fill back in. So he tried to be really targeted, really trying to just create a very small drainage hole or to draw it out through poultices. With from the veterinary perspective, there are a million, you know, poultices and things that we put on these things, but ultimately it's establishing drainage. If it is causing a cellulitis, then treating that secondary part. But otherwise, it's a matter of allowing it to drain and then grow out.
Dr. D, one more question for you. Do metabolic components come into this at all? Like Cushing's horses or anything along those lines?
Yeah, in actually in two ways. With Cushing's, that definitely does PPID because it has an effect on the immune system. So those horses do tend to have abscesses that either they get them more commonly, they don't resolve as quickly, uh, and then with metabolic horses, what you'll see, I don't believe that just metabolic syndrome is a direct risk factor for abscesses, but horses that have chronic laminitis, especially kind of low-grade laminitis, that hoof quality is not very good. So they're quite susceptible to forming abscesses. A lot of times, a horse that has a history of laminitis, if they present really, really, really lame, it's either the laminitis has gotten worse or they have a subsolar abscess or seroma, possibly. So it definitely plays in, and that's something that, we want to address from the medical standpoint for sure.
So this like so many topics that we're going to cover today requires a team effort, right? Because anytime the hoof is involved, the veterinarian and the farrier have to be in good communication, and it's nice when everybody's aligned on the path forward. So Lee, how about it? Let's bring in a farrier's perspective on this, when you're seeing cases that have an abscess, have had an abscess or in recovery or so on. Talk to us about your perspective.
Well, we see a lot of these, as a lot of horseshoers do. And I can tell you, Matt, I just absolutely love your perspective on everything. I think a simple approach in much of this is always the better way to go. And so with an abscess, I feel like it's either a broken leg or an abscess. That's usually the level of pain that these horses are in.
That's right. They're really bad.
And the short version is that I think if we could truly figure out abscesses, we'd all be retired, because as good as you can have it dialed in, I feel like they're unpredictable. But in short, there's usually a reason. There's trauma, something, thin soles, wet conditions. Anytime, if you think of the hoof as not a block of wood, like live tissue, and like a living thing, well, then it kind of changes your whole perspective. So if you think of the hoof as the head, so anytime there's swelling in the brain, it's a really serious issue, right? Because it can't go anywhere. So like if you have a bump on your arm or leg or something, when it swells up, it has some place to go. It's not that big of a deal. So that's, in my opinion, that's why it's such a struggle. And so when you can relieve the pressure, that's good. But I gotta tell you and warn everybody that is the juice worth the squeeze, is what I would say, because I've seen more serious issues from people digging at an abscess that shouldn't be holding a hoof knife. So I would just warn you about that. I feel like slightly digging at it is okay. Other than that, I kind of like to see them move around a little bit and soaking the foot so it will come out a little easier.
Nice. I like it. So for a lot of things, maybe sometimes less intervention is better, or more cautious than calculated is better.
Absolutely. And if you don't know what you're doing, or if you question if you do, that's probably a good indicator that you shouldn't be doing it.
Phone a friend, folks.
No, Lee, I'm glad to hear you say that, because what you'll see sometimes, and occasionally you have to really dig, it has to be a controlled thing, but that's where the farrier needs to be involved. You'd need a treatment plate, which is this thing that gets bolted on the foot that sort of seals it completely so that you can get in there, but it's protected, because otherwise you're taking away all that healthy tissue and leaving just that very vulnerable tissue. So there's very little barrier. And what'll happen is people will carve out a big area, the abscess will go away, but now they've got a weak spot again where a new abscess can form. So to me, that's a real concern. There is one other medical thing that I'd like to mention, and that is sometimes you'll hear that these horses should not get bute or other, NSAID drugs because it will prevent them from coming out. I don't find that to be true at all. And these horses, like Lee said, they hurt. They hurt a lot. And what I've found is if I feel like I don't want to dig and I haven't quite established drainage, I'll put a poultice on, but they're more likely to express that if they're walking around on it. We want them bearing weight on it. Not to mention, if a horse goes too long bearing weight only on one leg, we know we can actually create laminitis in that other foot. So to me, that argument of not using bute when they're that painful, I don't think that's a valid argument. I've never seen an abscess not break out because a horse had some bute.
Dr.
Matt, I got to echo you right there. I could not agree more with that. A lot of people have a lot of theories on this. On my own horses, I would absolutely butte them and let them move around as much as possible, just because you want to work it out. Because I've seen things linger up to 6 weeks
Oh,
if
yeah.
you're going to just let them stand around. Then I've seen them pop in a couple days when, in my opinion anyway, any way of increasing blood flow and movement will work it out quicker. Would you agree?
Oh, yeah. Yeah. And that's part of why I say, I mean, for one thing, they hurt, so keep them comfortable. But I agree. I think that therapeutically, there's a benefit to having them comfortable and moving around using that foot.
Absolutely.
Dr.
100%.
Durham, to follow up on that, this kind of got me thinking. I feel like so much in human and veterinary medicine, um, when things take a negative turn, it's because of secondary issues, right? Where you're trying to take care of one thing, and the first condition is causing something else down the pipeline that can be arguably even more chronic or, a bigger issue to deal with. And talking about bute kind of brings this up in my head because we've had quite a bit of experience at Platinum, kind of right in the middle of the research on protecting the horse's gastrointestinal tract when you've got them on NSAIDs and antibiotics, but that's a different topic for a different day. But NSAIDs in particular, since you brought it up, as a veterinarian, what would you recommend if you are going to bute your horse or it's going to be something that you have them on for a certain time period? What would you recommend to help support that horse's GI tract as you're giving them NSAIDs?
Well, I think, to back up a bit, I think these are all medications, whether it's antibiotics or drugs, NSAID drugs. We need them, right? They do an important job for us, but they all have trade-offs, and one of them is in the gut. We know that for sure with bute, but also antibiotics, And so for me, one of the important things is that we know from some of the work at Texas A&M and the work that's been done at other places is that we can benefit the gut by offering some probiotic, prebiotic, and other support. So I've always been a fan of Platinum GI for this reason. Now with Platinum DJ available. This is kind of exciting because it's this new formula that's a sort of an enhanced GI, so to speak, with some actually some joint support ingredients in it. So this would be another thing to consider. But for me, honestly, I would put most of my horses on something that contains those GI support ingredients. If they were on Platinum CJ for the highest, joint support, I would add in Platinum Balance. But GI is a great choice. And now with the new DJ, I think that's going to be a great choice because we often think about, are we harming the gut and protecting it, which is good. But there's also the whole benefit to the immune system overall that you get from having a healthy gut interface. So that's one of the ways that I like to go. Partly, I think if you have a healthy gut, you're more likely to have a healthy system overall. And, if you want a healthy hoof, you have to have healthy cells everywhere, really. And we can get into some of the more hoof specific stuff later. But I think overall health is important for, any kind of disease system we're dealing with.
No, I love your perspective on that. And I've learned a lot from you over the years. And there has been some great research that came out of Texas A&M and continues to come out of University of Georgia on that. And it is so important. And that's yet another area in equine veterinary medicine that we can learn from as humans too, taking care of ourselves. And we certainly have lots of aches and pains and lots of different NSAIDs that are used to make us comfy on a daily basis. So thank you. That just got me thinking about that. And I think it's an important thing to share, is not to underestimate the importance of the gut. That hoof is attached to a horse. So making sure you take a whole horse approach is key. So, I feel like we got a good look at abscesses. So let's kind of move on to our next one. And that is digging into hoof cracks. So what's happening here, Dr. Durham, and how would you describe hoof cracks and their challenges from the perspective of a veterinarian?
Well, for me, this is another area where I think you could categorize it in a dozen ways, but for me, there are two big categories. There are the ones that start at the coronary band and the ones that start at the ground surface. The ground surface ones are a lot more common. Some of that, where I live, it's dry, and some of if a horse gets overly long, then as the toe flares out, then you get some mechanical forces, and as the hoof is older, it gets a little drier, more susceptible to breaking down some of those connections. We think of hoof structure in terms of the protein. It's mostly keratin, which is this really interesting protein. It's rubbery. There are people that study it that are trying to mimic it, in the lab to come up with a structure that's as rubbery and resilient and powerful as keratin is. But one of the main things that's important is in between the tubules, you have the intertubular cement, essentially. When you think about how hoof grows, it's essentially like hair. It's, all over the body, the head, whatever, but each hair essentially is like a tubule, and then they're all glued together as they're created, either at the coronary band or in the sole.
Didn't Lee Olsen describe the hoof as hard hair in our navicular podcast, and that's stuck in my mind ever since then?
We did talk about that, yeah. But that's essentially right. It is sort of hard hair. But what we know is that one of the important factors for hoof strength is that the integrity of that intertubular cementing substance. So if you get weakness there, then you're more likely to get penetration of water from the outside, which is not good. And you're also more likely to get separation of the tubules at the sole surface. So for me, those ones that start at the ground surface are usually a combination of integrity of hoof, that maybe the hoof is getting wet, dry all the time, which pulls some of the protective qualities out of the hoof. There can be some mechanical stuff going on there if horses aren't being attended to regularly. And then the ones that start at the coronary band, those for me, I'll be curious to hear Lee's opinion on this, but those tend to be more mechanical. And it's common in the quarter area. And what'll happen is the tubules kind of get jammed because there's too much pressure on them. And so what ends up happening is they sort of start to peel apart as the horse is bearing weight. It sort of causes this peeling force up at the coronary band. So for me, there probably is some degree of hoof quality that contributes to that. It, could more easily peel apart if you have poorer quality hoof, but a lot of that is really mechanical. And that's where getting a good farrier who knows how to float that, not just under the heel, but under the tubules that are growing down. One way or another, with some of those that start at the coronary band, they'll peel all the way open to the point where they're down to sensitive tissues. And that can be usually is not a big problem, but it can actually be a concern because of the potential for infection at that level. In general, those for me tend to be um, more of a mechanical thing that needs expert farriery to resolve.
We happen to have one here today. So,
What'd I leave out, Lee?
farrier. Lee, give us your take, because I'm sure this is something that you see for sure.
Oh yeah.
Yeah, I see it a lot, and there's a lot of confusion amongst horse owners. So I'm going to kind of target them on this one. So if they start at the bottom, in my opinion, that is a quality or nutritional problem. So to back that up, so if we all agree that the hoof is hair, right? And do you think, everybody listening, do you think that you can judge how someone is doing by their hair? I think if you see a rough, dead-haired horse, you know they're not doing very good. Or if you see a horse that's shiny and slick and looking good, you know they're in good shape, right? Well, in my opinion, that's the way cracks that start at the bottom go too. So clearly we all love platinum, but I'm telling you what, everybody asks me, what kind of oil can I put on them? That's just something to keep the horse owners busy. That's not going to work, in my opinion. You want to get them over that, get some good shoeing, get that horse on a nutritional program through Platinum. If they start out at the top, to me, that is a mechanical failure, just like Dr. Durham was saying. Two reasons that'll happen: conformational or bad shoeing. I hesitate to, I don't ever want to call anybody out, but I mean, that's just the way it is. And sometimes you got to speak for the horse. So the way that happens is that the hoof is a beautiful thing. God really knew what he was doing. Like the coronary band, in my opinion, is a shock absorber. So if you have the heels too out of balance, it's not a big deal for a little bit. But then it pushes it up and the hoof levels itself by moving the coronary band up. Well, it can only take it so long, and then finally it'll break, and then it'll shoot a crack down, and that is how you get a quarter crack, in my opinion. And that can happen from conformational problems like uneven loading, crooked legs, things like that, or just a lot of farriers have a problem of being right-handed or left-handed, meaning they trim the same side of the foot high and the same side of the foot low on every foot. That can create that. So starts at the top. Somebody made that, whether it's conformational farrier, starts at the bottom. You need to get your horse on Platinum.
Interesting. Well, there you have it. I mean, I couldn't have said it any better, Lee. But no, that definitely is a condition that you can recognize nutritional deficiencies and things like that, just like when we have a dull coat as humans, versus a shiny, healthy coat. We always say that at Platinum, a lot of people say, oh, that's the biggest difference I see is my horse is so shiny, and it's like, yes, 100%. And we love to see that. But the outside is reflective in terms of what the inside is feeling. So when they're properly nourished and getting those key nutrients, the outside shows what the inside is feeling. So
can I make a quick comment on that? So we're at the Houston Rodeo right now, and Jamie is running in the semifinals tomorrow. And her good horse, Amy, has been on Platinum for quite a while now, and she noticeably sticks out. She is shining like a seal. Like, I mean, literal, nearly reflective. Even the photographer was saying, your horse is so shiny. And then you look down at her feet and there's no problems. There's no special shoeing. It's all just healthy.
Well, that's great. And Jamie's got a guy for the feet. Lee is referencing his spectacular athlete of a wife, Jamie Olsen, by the way, who's a WPRA barrel racer and doing really well in Houston. So thank you for that, Lee. And, now kind of moving on from cracks to a condition that Lee, I just saw you post about this on your social media, which if you're not following Lee Olsen on social media, you should be, because he posts some really interesting things from his day-to-day life inside of Olsen Equine and the cases that he sees. But I just saw you post about this on social media not long ago, and it's another one that I feel like could use some clarity around it, and that's white line. And so Dr. Durham, we'll kind of go to you first again for a veterinary perspective. What is white line? And can you explain this to us as a veterinarian who I'm sure has seen his fair share of these cases?
Yeah. So this is still, there's still a lot that's not fully understood about white line disease. Um, in general, it is an infectious thing, but again, not infectious into those sensitive tissues. It's it's along the lamina essentially for the most part, coming from the sole surface up. Um, One of the most convincing studies I've seen showed that it's fungal. And that makes sense to me that it's more like toenail fungus in people. The fancy term is onychomycosis. Uh, and the interesting thing is that it'll penetrate up a little tiny fissure in the foot, and then once it sets up shop, it can create this huge defect. And we can see that radiographically with X-rays because you see the gas a lot of times. Um, what's really interesting is that to me, this is also reflective of hoof quality. So nutrition does often play a big role. There's some controversy about, pastures with high sugar content causing white line disease. I'm really not convinced of that personally, because a lot of times it'll be in one foot, it'll be in the medial quarter, say. Um, to me, that's not not a specific nutritional thing. Nutrition in terms of sort of a vulnerability, a weakness overall in the foot, I think is reasonable. But once the fungal organisms get sort of set up in there, then they'll just keep eating away at the tissue around it. So what'll end up happening sometimes is at the ground surface, there might be just a little crack, just a little dark spot. But then I've seen this a couple of times where owners were really mad. Oh, the farrier missed this. How could they miss this huge hole? Well, if it's up, an inch above the ground surface and all you have is a little, it's kind of like a lollipop, you've got this little thing leading up to this ballooning out area. And what'll happen is once the farrier trims the foot, as it's growing out, then sometimes they'll pop into that big cavern and it looks like, well, how could that have ever been missed, but it doesn't necessarily have to be that big at the ground surface. So for me, one of the frustrating things with white line disease is the farriers that I've worked with really felt strongly that you had to expose every little bit of it and maybe a little bit beyond. You wanted to get to healthy tissue that was kind of pink to the point where, you don't want it bleeding, but you want to be right at that uh, border. Um, this requires someone that really knows what they're doing because you don't want to just start, hacking away at hoof. But for me, if it's not completely exposed, then in general, the the cavities are a lot trickier to fight. And this is one where I think one of the big sort of debates is over whether you should use things like copper and the heavy metals. They used to use mercury, merthiolate had mercury in it because it killed stuff, versus some of the things that are a little gentler. The argument in favor of copper and some of those things is that they stick around and they kill bacteria and fungus, which is a good thing, right? The argument against some of those is that they may be a little harsh on that sensitive tissue that we're trying to regenerate. And if we kill off some of those new cells that are just trying to do their thing, then we may actually slow down the healing process. That's where some of the other substances come in that are kind of easier on the tissues. Again, there's sort of I don't think there's a consensus on the right choice for that. I moved away from some of the metal-based stuff for thrush and for white line disease, partly because I felt like some of those, especially with thrush, some of those sensitive tissues just weren't regenerating as fast. Um,
So
What the one other thing I want to say about white line disease is that depending on how severe it is, it can actually, most of the time, the horses don't start off lame, but it can get to a point where uh, if it's widespread enough, then the attachment between the bone and the hoof breaks down. This can happen on one side instead of the other, so then the bone will list to that side, or it can actually kind of rotate. It's not true laminitis, but I've heard it described as laminosis, which kind of makes sense to me because you do have a breakdown of the lamina, but it's not an inflammatory type of breakdown. So essentially, you're creating that separation between the hoof and the bone, which mechanically the horse really needs for support. So for me, I always want to work with a farrier because a lot of times, if if hoof has to be removed, then we're going to need some creative shoeing to stay on for one thing, but also to protect and to support the hoof in ways that will keep that horse comfortable. That's generally my tactic.
I love that. I always learn so much from you. That was very interesting. And this is such a mealtime podcast, isn't it? We're your source, folks, for fungus.
These are horse people; they're used to it.
Right? I mean, come on. You're among friends. Lee, um, shoot us straight on white line. I mean, what's your perspective on it? Because like I said, you definitely see your fair share.
Well, this is one thing that we work a lot on, and like everything, I like to keep it simple. So I think that white line disease, and you say it, people are just like, "Oh my God, it's cancer" or whatever. But it's not. It's if you know how to handle it, it's really not that big a deal. I'd way rather have that than a lot of other things.
For
So
sure.
here's the thing. People spend years. I've seen them mess around for a long time, taking a little bit of it off. So ultimately, my opinion of what white line disease is first. So it's something that you cannot get to. It's you can treat it every day for the rest of the horse's life on the bottom of the foot. You'll never heal it. But if you have someone who knows what they're doing that can come in and remove it, then you've got a chance at getting that horse healthy. So it can spread all the way up to the coronary band. It can take up a little bit of the foot or all of it. But the point is, in my opinion, you have to get it off there because it's anaerobic, meaning it thrives in a lack of oxygen. It's fungus and bacteria. So either way, whatever you're going to be treating it with, it doesn't matter. If you get it all off there, the air can get to it. And being anaerobic, when it's getting in the hoof wall, it just runs from you. And that's why I say it's like a terrorist. You'll never get it. But if you take it all off with a knowledgeable farrier, it's pretty actually simple, in my opinion. I'm not giving anybody permission to try this, but ultimately, you take it off, and if it's black and necrotic and mushy, it's got to go. And if it's healthy, then it stays. And in my opinion, you can treat it with kind of whatever you want, just as long, like Matt, I really appreciate what you're saying. You're ultimately saying don't use caustic stuff on live tissue, right?
Well, I mean that's it's one philosophy. It's kind of the way I've moved for sure.
No,
Yeah.
I couldn't agree more because we've been extremely successful with this. And the two basic principles, get it all off there. And we try really hard not to ever hit blood or cause discomfort, but you do have to get all the necrotic stuff off. And then you have to replace the support that the horse has lost. Most of the time, these are in the toe. The toe is the strongest part of the hoof capsule. So you have to replace it. I don't care if you love barefoot, I like it too. But this horse needs a shoe and a rigid one and a heart bar and probably a pad because if you do this right, it's no big thing. Usually these horses go right back into action immediately. And then you just have to watch this slowly grow down the foot. And that's about the only problem it is. But you try to leave this horse barefoot, like Matt said, he could rotate. There could be some really bad stuff happen. So you need to, if you got white line disease, save yourself some time and money. Just go get a good farrier and a good vet, knock it out, and be done.
Amen.
Yeah, the little picking at it or trying to put some stuff on it, it just like Lee says, that's been my experience too. You'll just keep fighting it, and generally it'll just keep getting bigger under the surface. So getting after, once you've really identified it, I think getting after it's the way to go. And sometimes if it's found early, you know, it's a fairly small area that has to be removed. And then if you can maintain that to where it's all healthy tissue, it'll grow all the way out. And once it grows all the way out, you have a normal hoof.
Absolutely. And if I could chime in real quick, Jesse, one thing that we didn't talk about quarter cracks that's relative to this, I do think that quarter cracks need cleaned out because it's ultimately like a crack in a house, a wall crack. So once you end up fixing that, you need to clean it out. But why I bring this up now is just like white line disease. You go to putting glue over top of a quarter crack or white line disease, you run a very high risk of an infection. And now you went from a little problem to a very serious problem. So know what you're doing or don't do it.
I think that is words to live by for sure. You two are always good for words to live by, and I think that those are good ones. Okay, so I want to move on to a condition that I will preface it with. This is very unfair to ask you both to stay at surface level because this one is about as big as it gets, and that's laminitis.
There's not much to talk about there. Yeah, that's easy.
No, there's no controversy. Super simple. Neither of those things are true. So, but it's also one of my favorite things to talk about because it's fascinating. And there are so many different avenues to not only what causes this condition, but how to prevent it, how to manage it, how to treat it, how to do all the things. And so we also have a very in-depth podcast and corresponding article online at Platinum Magazine talking about laminitis, and it features some of the most well-versed veterinarians and researchers in the country. So we're talking Steve O'Grady, Andrew Parks, Mark Silverman, Craig Lesser, some very brilliant guys that go deep on this subject. But today, I want to talk to Dr. Durham and Lee about this and get a little bit of a, as 30,000 square feet or 30,000 foot view as we can go on laminitis, because it is deep. This is a condition that affects the coffin bone or the P3. It has a lot of names and a very important function. And one of the things that I find so fascinating, I guess, about laminitis is that it can exist in a subclinical form for a long time before it rears its ugly head. And it shows you how important nutrition and management and training and managing stress and immune function and healthy metabolic function, all the things, that go into keeping a healthy being, being this horse, how important it really is. And so, Dr. Durham, I'm going to come to you for a veterinary perspective and to give us, a view of the causes, how you're looking at this from a veterinarian perspective. And the causes can be far-ranging. There's a big, long list of them that's kind of filtered down into three main avenues into this disease state, which is sepsis-related laminitis, endocrinopathic, multi-syllable word, or metabolically related, essentially, laminitis, or support limb or contralateral limb laminitis, which we've referenced before in this podcast. And I remember Dr. Steve O'Grady, who is a dear friend of mine, and I just adore him. And he's one of the most well-respected veterinarian / farriers out there. And I remember Dr. O'Grady commenting on this, and he goes, "This is such a frustrating condition because it's almost like treating a disease in a box, and it's Lee kind of referenced that earlier. He goes, you can't see it, you can't feel it, you can't palpate it, you can't look at it. It's a disease that is encapsulated in the hard hair that we were referencing. It's real tough to get to. And there's so many things that play into it. But Dr. Durham, with that very long introduction, I would love to get your perspective on it because it is so fascinating. It is so big.
I'll try not to ramble too much. I know Lee and I could probably talk about this all day and all night, but uh yeah, so the by far the most common that we'll see is the metabolic horse, right? The horse with that has true equine metabolic syndrome. Um, Before we get into that, let me just talk about those other ones, the septic related and the support limb laminitis. The the important thing to consider as far as anatomy goes, and again, you could spend hours talking about the intricacies of the anatomy, but the lamina literally means folds. It's like if you have a curtain with that, there's kind of the lining curtain and then the other curtain, and they both just follow each other along. Essentially, what's happening in the hoof is that you've got those two layers, the layer from the dermal side, which is where nerves and blood vessels are, and you've got the layer from the epidermal side. That's like the top layer of your skin, or the outer layer of hoof, where there's no blood supply or nerves, but it's important material. So when you look at, if you were to say compare a horse and say a camel, the camel has a very intricate multi-level digital cushion. Most of their weight is actually supported on the digital cushion, where the hoof, they call it a claw in camels. There's very little attachment there. It does some function, but it's really not very involved. Move on to cattle, sort of in between. They have laminae like horses do, but they're much less complicated. And they walk on their digital cushion a bit more than horses do. Now, the digital cushion in horses is important, but it's a secondary weight-bearing structure. So the wall is really the primary weight-bearing structure. And what's really interesting is that the wall is sort of like a cone, and essentially the coffin bone is essentially suspended by the hoof wall. So if you think about, you go into a big box store, Costco or wherever you like to go, if there's a dropped ceiling, then you've got this framework, and all along there, that whole ceiling is really heavy, right? The attachment of that is very uh, uh, spread out, because there are all these little rods that hold that ceiling, that dropped ceiling, in place. The overall weight of the ceiling is spread out on all those thousands of rods, right? If you were to start cutting along one edge, then you would get overload of that ceiling, and then it would start to overload the ones that were still supporting. That's essentially what ends up happening with laminitis. You'll start to get a little bit of breakdown, then you have fewer attachments, trying to do that same job. Essentially, what ends up happening in the name laminitis is inflammation. So the triggers for that come in a couple different flavors. And honestly, some of the people that have studied it all their lives are still figuring things out. It's a fascinating condition, but essentially at the junction between those two types of lamina, you get a breakdown, and that can be triggered by several of these different diseases. So if it's the non-weight bearing type, the hoof acts as a pump, and this is actually where the digital cushion ends up being really important. And a little bit back to what Lee was talking about with abscesses, is that the foot actually acts as a pump. When you think about how far blood has to travel from the hoof all the way back up to the body, up to the chest, the hoof actually acts as a pump. And as horses shift weight or walk around, then the blood is flowing through that hoof really well. if you have a horse that's really lame in the right front from a fracture or something like that, and they're just constantly standing on that left front, then that pump of the foot is not working. And you get sort of stagnant blood flow, this sort of thing, and overloading of the laminae. And what ends up happening then is that you can get a breakdown of that. And the scary part of that is a lot of times that is sort of delayed. It'll be maybe a week or 10 days after that event. Um, with the toxic type, the main things that we'll see that will trigger that are I had a client who stored, their grain in a trash bin, and they had this little flimsy latch on the door. One of the horses got out, popped that latch, knocked the lid off, ate, probably a bag of cob, and we did everything we could, but the horse ended up with colitis and really bad laminitis. Another thing that'll trigger it is a retained placenta. So that's something that obviously we should deal with as soon as possible, as when a foal is born. Um, with the endocrinopathic one, the EMS, this is the thing that we see by far the most. And like in people, it's similar to diabetes in people, but not the same because it's related to glucose and insulin. And in general, in people, we talk more about the glucose because our glucose levels can really fluctuate quite a bit. In horses, the glucose doesn't, but the insulin does. And in particular, in horses with equine metabolic syndrome, then those insulin levels will start to spike with all sorts of different triggers. And we know that this can happen even from things that we as veterinarians do. If we do a joint injection with steroids, there's the potential risk, particularly in horses with EMS, for triggering this laminitic response. And in general, like in people, obesity is a risk factor for diabetes in people. They'll say if your waist gets above a certain level, your risk of pre-diabetes and then diabetes goes up. There are certainly some situations where it's not related to weight, but we know in horses, more often than not, it is related to weight. And in particular, actually, another funny story is when I was a young vet, I was out and this farmer said, when their crest gets hard, I think that's when they get laminitis. And I rolled my eyes and I thought that was stupid. He was right. This is absolutely true. And they've actually measured the crest and, created scoring for the crest of the neck. But when the crest is bigger, the risk for laminitis is higher. The level of responsiveness to any of the tests we do for EMS correlates with that pretty well. So in general, doing the body condition scoring on a horse is really critical. And then ultimately, it's managing the sugar content is really the most important part. So that's managing when a horse eats on pasture. We know that when there's photosynthesis, when the sun's shining, right, that's when sugars are being made. Overnight, that's not happening, so those sugars are being used. So unless the temperature gets really cold to the point where it can't use those sugars, then grazing first thing in the morning can be better. Looking at the hay tests is important. You want to have the sugar levels to be below a certain level. Soaking, there are a million things we could talk about with that. But ultimately, I think the issue is that, particularly with those EMS horses, is that it starts as a metabolic problem and it becomes a mechanical problem. But just because we address the mechanical problem doesn't mean that the metabolic syndrome can't trigger again. and then you have more mechanical problems. So with those horses, it's a constant battle, and it's not that, well, we've dealt with the EMS, so now it's the farrier's problem. That's not right. And once the farrier does what they need to do in terms of the trim, and there are a million different approaches to this, I'll leave that to Lee to discuss. But ultimately, just finding the right mechanical solution, if you're lucky, before there's actual separation, there's just inflammation, and you can actually keep it from ever rotating if you get them really, really early. Later on, once there is rotation, then it's a battle. The ultimate goal is to have a completely healthy hoof grow back. That's not always doable. Um, anyway, that's the summary for the medical part of it. I'm sure I'll think of some other things, but we'll let Lee talk about how to fix laminitis. Easy peasy.
Yeah, no pressure, Lee. Get on that. But there's so many different options here. I mean, you've got the wooden shoe that Steve O'Grady's talked, a good portion of his career about. You've got all these different interventions from a farrier's perspective. How often are you seeing this, and what is your approach, knowing that no two cases of laminitis are ever identical,
Yeah, so this is a monster, and I'm going to do my very best to stay out of the weeds here. But here we go. So, personal opinion, farrier perspective. What is laminitis? Laminitis is inflammation of the lamina. What is the lamina? The lamina is the bond that holds the sensitive tissues to the insensitive tissues. That's the cement, it's the glue. So, you have a very serious issue because on healthy lamina, that's what holds the hoof capsule together. It's the bond. On a healthy lamina, the strongest guy all of us know cannot pull it apart. On one that has inflammation in the lamina, a child can just pull it apart, just falls apart. And that's how what we're always worried about is rotation, meaning founder. So that's when the coffin bone moves. And how that happens is that bond gets weakened and the deep flexor pulls on the back. When that horse rotates, there's some derotations, I guess, that might work, and you might have to cut the deep flexor. But to me, you need to exhaust every effort in preventing rotation. So if you think you have laminitis, you need a vet. You need him right now. You need to calm that down, that inflammation immediately, in my opinion, and it could save your horse's life, truly. I think as a farrier perspective, like when you're talking about acute laminitis, meaning it's fresh, the horse is just lame, something's going on, you need a vet. And if it were my horse, I would be reaching for the ice. I've seen that work. I'd like to know Matt's opinion on that, but ultimately you're trying to calm down inflammation. So meaning having as much ice on that horse's feet for as long as they can take it. And the studies that I've seen, Matt, I don't know about you, but it cannot be overdone, and you cannot hurt them by doing that.
Actually had some really interesting things to say in the podcast where we talked to Dr. Parks and Dr. Lesser and Dr. O'Grady on that, and saying they're big advocates of putting essentially an ice, Dr. Durham can give it the official term, but more of like an ice boot, and getting that cold therapy really intensive up the leg. Dr. Durham, what do you think there?
Yeah, I mean, I think the science is pretty strong on that. If you can truly lower the temperature well enough, then you can stop the damage. Part of that, we know that some enzymes don't work when they're too cold. They need to warm up, and so part of it's that. Part of it is the anti-inflammatory action of the cold. What we know is that some of if you have, like at the vet clinic, we'd sometimes use an old fluid bag and just kind of tape it on. And what we know is that probably is not enough. It's probably not going up high enough to do a good job. That some of those ones that really need to go higher and where there's direct contact, they're going to decrease the temperature enough to do that. I have heard there's an argument that that laminitis can be triggered by cold, but that this happens in some cold climate areas. But in general, I think for me, I've never been really convinced of that. So my opinion is what Lee said, is that I don't think you can overdo it with the cold. Um, and honestly, it's one of those things where, we've studied laminitis for years. And one of the things that I think in Roman times, they knew that you could walk them into a cold creek, and cool their feet, and that would make them more comfortable. And here we are a couple thousand years later, and what we've come up with is maybe we could cool the feet down. That might work. And not to belittle, there's some really innovative things that some of the researchers in laminitis have come up with in terms of some medications and other things that they understand down to the cellular level. But ultimately, that's kind of where we are.
No, I think it was Dr. Lesser, in our conversation that said, proper administration of cold therapy is one of his most useful tools, in
Yeah.
there. And I think Dr. O'Grady was saying, getting him into a continuous ice slurry was the key for like 36 to 72 hours. I mean, is continually icing that foot. But he said, hey, if you're going to put him in a cold tub of water with ice cubes, like that's not going to do the trick. It's not going to harm him, but it's not going to do the trick. But that ice slurry and getting it super cold is really beneficial.
Yeah.
Yeah.
As far as shoeing them, I would just say that you have to remember you're working on something that ultimately has a fever. So the last thing you're going to want to be doing is driving nails into that for two reasons. You don't want to cause a problem in a hoof that already has an issue. And also, most of those horses don't like you banging on their foot, kind of like if you had a toothache, you're not going to want anything happening to your face. So glue-on shoes are really popular, clogs, ultimates, anything that slides on. The fact is that if this doesn't make sense to you, right now, I would highly advise that you don't work on these horses, because even when you know what you're doing, this is so frustrating because you can do everything right and get them going good, and then they have a moment and then they end up dying. It can be a very terrible disease. So that's why I would just tell you, like, if you think you have laminitis, you need a vet right now. And then when it comes to shoeing them, I refuse to shoe these without x-rays, just because if there is any rotation, that is a totally different deal. And just like we talked in the navicular podcast in the article, with these horses, it is shoe placement is crucial. And I truly believe in shoeing them around the center of rotation. So I don't care if you use a clog, whatever you got to do, but you've got to get that balanced, hoof capsule balanced, because now that if there's rotation, all bets are off. Whatever you think you see on the outside is irrelevant.
100%. I love that. And, I also love the adage that the best case of laminitis is the one that you never get. And so prevention with this particular disease state is where it's at, and maintaining a healthy metabolic state and a healthy horse, and making sure that that is not a condition you ever have to deal with, because it is one with such lasting horrible effects. And we never want the horse to have to feel that or go through it. And it's a challenge, veterinarians and farriers alike. But it's also one that when it does present itself, that communication and great working relationship between the veterinarian and the farrier is so key, because it takes those two areas of expertise, no question. So thank you guys both, for that, for the insight on laminitis. And like I said, it's a topic where we can go deep, and we certainly did do that, on that podcast and article. So I really encourage you to read up or listen to that if you want to know more about that specific condition. And another one where we did the same thing is navicular. So just like Lee referenced, we did have a recent podcast and article on navicular syndrome. And I'll let you guys give us a little bit of a glimpse, because we also went deep on that. But we'll talk about it briefly here, because that is certainly one that we don't want to leave out. It is a very common condition, but what I learned from the both of you is it's also a commonly misdiagnosed condition, because there's a lot at play here. And the navicular bone itself is not necessarily always to blame. So Dr. Durham, give us a snapshot, if you would, of this condition. It's another unfair question.
Well, I think what you've touched on is exactly right, and that is that in the in even in the 1980s, it was sort of considered as one disease. It's degeneration of the navicular bone, and what we know now is that just the bone itself can be affected in multiple ways, and that dealing with that is addressed in multiple ways. Ultimately, a lot of it does have to do with the fact that that bone acts as a pulley for the deep digital flexor tendon at the back part of the coffin joint. So mechanics play a huge role in it. But if you're dealing with one of the connections to it, one of the soft tissues that support the bone, or if you're dealing with damage to the deep digital flexor tendon, inflammation in the bursa, all of those things play in various different ways. One thing I would say is that no matter what disease we're talking about here, laminitis, navicular disease, pastern joint arthritis, ring bone, horses that have a healthier hoof do better. And I think one of the things that, as a farrier, the fine art of balancing, you want to have a good, healthy sole mass without too much breakover, figuring out exactly where that breakover should be and the balance of the foot. But ultimately, I think if a horse has better sole depth, laminitis is easier to deal with. Navicular disease and all of its cousins are easier to deal with. Having a healthy hoof makes a difference for all of those things. In terms of, nutrition, obviously, when we're talking about laminitis, then a big part of that with EMS horses then is battling sugars. Then, if we're just talking about hoof health, ultimately, I think we're talking about cell health because the hoof is constantly regenerating. Every moment of every day, there's new hoof growth going on. And although we don't really think of the hoof as uh, an organ that needs a lot of metabolic activity, we're thinking about the kidneys and the brain and muscle, but the hoof has one of the highest metabolic demands in the body. So that means energy wise, you need a constant supply, but also the factory needs a constant supply of each of those ingredients. All of the particular proteins, the sulfur containing proteins, sulfur creates those disulfide bonds, which means, a bond between two molecules. They're really strong. All the provitamins and minerals that help support the hoof. But ultimately, even just the omega-3 fatty acids that have such a correlation with hoof and hair quality that just getting a healthier sole underneath the body, I think is such an important thing. Anyway, I've gone on a tangent, but for me, the navicular syndrome, the whole suite of diseases that are involved there, I think really need a good diagnosis and a targeted treatment ultimately. And that may mean injecting the coffin joint. It may mean injecting the navicular bursa. It may mean shockwave therapy, potentially even scoping the bursa, like some surgeons are good at doing. But then working with the farrier in terms of coming up with the right plan for each horse, depending on the subtleties of the disease.
Yeah, I love that. I mean, Dr. Durham, your tangents are much appreciated, sir. But Lee, I'm going to throw it over to you in terms of a shoeing perspective. And again, we did go deep on this on our navicular podcast, so we won't go quite as in depth today. But one of the main takeaways that I was happy to learn from you is really focusing on again on that center of rotation.
Absolutely. So I feel like in any of these problems, good shoeing is crucial. But when you're talking about a condition, right? Something in there is wrong. And my pet peeve is that navicular is the most overused term there is, because thanks to the MRI, we can figure out exactly what it is. And A, how Matt can treat it, but B, how I can shoe it, because that's going to have totally different needs. And if it's got a bursa problem, or if it's got an inoperable cyst on the navicular bone underneath the tendon, maybe, you cannot ever load the frog on that horse. So just for an example, so if this horse is really nice, I would highly encourage you to just go get an MRI. If he's insured, you can probably get some help there. If not, I'd rather see you spend the money getting an MRI than taking him to 3 or 4 vets, like I see a lot of people do. Spend at least $1,000 at each one of those, and you could have got an MRI done and had this wrapped up in 2 weeks. So that is my perspective. Like, you really have to figure out what it is. Okay, what's wrong? And then shoeing with x-rays is so crucial. I know you guys probably think I'm crazy that are listening, but it's so important, because if the navicular bone is ultimately a fulcrum, the deep flexor tendon runs around behind it. So when ever there's a problem, say a lot of feet don't look that bad when you're looking at the hoof capsule, and then you x-ray them, you'll find out they're negative. Well, he's been negative for 10 years. Somebody didn't catch on to this. Now you got a deep flexor problem, bursa problem, or an actual navicular bone problem. So now this horse is going to need some different needs in his shoeing, meaning he's going to need a higher elevation, more breakover. And I know breakover gets a bad name, but the fact is that the quicker this horse breaks over, it means the quicker his foot comes out of the ground. So when you think of this horse in soft footing, like a lot of them are in, the longer the foot stays in the ground, the more the heels come down, the more the deep flexor gets pushed. And you know what the deep flexor pushes? The bursa, the navicular bone, just jams it right into the pasterns. So you've got a real problem. So if this is a nice horse, or even if it isn't, if it's your horse, I feel like you owe it to him to make him feel better. So get an MRI, have your farrier shoe him with x-rays, and not just before. Get some x-rays a couple weeks before and give them to your farrier. I truly believe in, you take an x-ray, you trim the foot, you take an x-ray, you shoe the foot, and then you take an x-ray to make sure you got it where you want it. And that may sound excessive, but I'll promise you, if you're willing to change it, if you don't have it right, you will cut off so much time. People mess around with these horses for years. You can turn this thing around in one shoeing if you do it right, but you're just going to have to kind of go all in. And that just might mean paying your farrier a little extra to meet you at the vet clinic, or have your vet meet him and the farrier meet together at your house. And in my opinion, all of the good farriers and vets like doing that, because usually they care about horses and they're confident enough in their skills to put them out there.
Well, and the outcomes are going to be better if we're working as a team, for sure. Instead of each person kind of trying one thing at a time. And what I would like to add on to what you're saying about the x-rays, I completely agree. I think there are a couple of things about it. One is they should be really done carefully. Taking those podiatry x-rays gives us a lot of information, but we can, if we don't set the foot on correctly, if we're sort of rotated, if the beam angle isn't quite right, then some of those measurements can be off. So it's something that I think should be taken very seriously. The other thing is, I encourage people to get a baseline set of x-rays, podiatry x-rays, when the horse is sound. This way, you've got this, here's when everything looked good. Maybe it doesn't look all that good, because a lot of horses are are they're good at hiding something, right? They want to do their job. They're working hard. They're not necessarily lame, but there's something that's not quite in balance, and we might pick up on that. Or you might have this beautiful set of x-rays where everything's in balance, everything's aligned the way we want, shot around the center rotation, everything just looks right. But then you've got that as, okay, here's our baseline. Here's where we want to be. Uh, and then you've got that to compare to if something does go wrong, where you can say, wow, they actually the angles look the same, the breakover's the same, what's going on? Versus, okay, our heels have really collapsed, our breakover is long, that sort of thing. And then the other thing to add is that I'll have clients that'll say, we just took x-rays 3 months ago. Well, that was 3 months ago. If you're talking about the hawks, then taking x-rays every time they need to be shod would be way too much. Those bones aren't going to change that quickly most of the time. But the hoof is a dynamic structure. And like Lee said, we're taking those x-rays for two reasons. The diagnostic part, do they have a spur in a joint? Do they have swelling here? Do they have a wing, an extra wing on the navicular bone? Do they have cysts? That's the diagnostic part. But also we're looking at it from the mechanical map, so to speak. That part changes throughout the shoeing cycle and definitely before and after the trim, right? So this is why people will balk. They'll say, well, we just took x-rays with the shoes on. Why are we going to take another set? But what Lee says, do the trim, take the follow-up x-rays, and you may not have to do that every time, but when you're dealing with something that's really coming up, that's a new problem, then doing that can be really helpful. I've been in a number of situations where we're all looking at the foot thinking, yeah, that looks great. We take the x-ray and we all say, oh, I guess not. And then the farrier can address that at that time. Whereas once the shoe's on, then you'd either have to pull it off or wait until the next time. And if you don't fix it the first time, you're really not doing the horse a favor long term.
100%. And for those of you listening, not watching, the set of well horse podiatry x-rays got a 2 thumbs up from Lee Olsen as well. So it's all the preventive steps, right?
I would encourage everybody to do annual shoeing x-rays and have a lameness exam done by a knowledgeable veterinarian. And you can catch these things so often. I mean, we do that with Jamie's rodeo horses whenever we get a chance, whether they're sound or sore or whatever. And honestly, we keep them extremely sound that way just because we don't wait till the straw breaks the camel's back. And I would encourage everybody else to do the same.
Fair enough. And, one thing I want to bring up in closing is, we're Platinum. We obviously live in the world of advanced nutrition and helping to keep horses as healthy as we possibly can through nourishing them correctly, right? And it's the same thing that we think of as humans, where we don't feel well when we don't eat well. We certainly don't perform at our peak. And going back to what we spoke about earlier, that hoof is attached to a horse, as is a joint is attached to a horse. And all of these little pinpoint issues that we can have within a horse's body. I love how equine veterinary medicine is going so much more toward a whole horse approach, as in root cause. What made this happen? What made it manifest in this specific area of the body? And how can we support the horse's overall health as we zero in and also target this specific problem? So, Dr. Durham, keeping that in mind, there's a lot of information out there about nutrition as it relates to the hoof. A lot of people think if you feed the horse biotin, you're good to go. That's all you're going to need. You talked a little bit about the metals earlier, if you feed the horse copper and so on. But it's broader than that in a lot of ways, right? And one of our philosophies at Platinum is, hey, first and foremost, support the overall health of that horse, right? And a healthy horse theoretically is going to have a lot less problems in the long run, just like a healthy human is going to have a lot less problems in the long run. And whether that's metabolically, whether it manifests in the hoof, whether you're taking steps to support the horse, so hopefully you're not going to have perhaps as many joint issues or soft tissue issues or so on. You're giving the body the building blocks it needs to support itself. And as much as we are, we respect veterinary medicine to no end, nothing can support the horse's body as well as it can support itself if given the right tools. So talk to me a little bit about the nutrients that, you and I are needing today, but we've got these terms that are thrown around and a lot of people are like, yeah, I hear about omega-3 fatty acids all day long, and antioxidants. Okay, great. That sounds fancy. Not quite sure what it does. And then you've got the more hoof specific nutrients, but talk to me about that. And how, as a veterinarian, between yourself and your colleagues, you really are using nutrition to support these cases.
Well, I think, to get back to the whole sort of proactive idea, the preventive medicine idea, I really like when I started really pushing clients to say, hey, let's do these sort of proactive, let's not do a lameness exam, let's do a soundness exam. And I found that with those horses, if I was seeing them frequently, I ended up injecting their joints less over time because we were able to, keep, I feel like if the body is able to use itself properly, then some of those stresses are less. And with nutrition, I think that's another perfect example of that, where instead of waiting until something's broken and trying to fix it, we're trying to elevate these horses. And one of the things that we've seen, and it shows up in studies too, but horses will be fine. You can have a horse that's okay. You walk out there and they're eating and pooping and doing their job, but they're not really thriving. They're not up at that next level. And that's really, especially with performance horses, that's where we need them to be, right? We need them to not be okay. We need them to be thriving. And one of the ways to do that is to make sure you don't have any potential small gaps in your nutrition. So all of those trace minerals end up being really important. Copper and zinc are very important in the intertubular cementing substance. They're also important for some of the enzymes that help to propel the laminae. The two types of laminae actually have to break down each attachment between each cell and sort of ratchet down so that the hoof can grow, because the laminae attached essentially to the bone don't move, and the other laminae have to slide over the top of them. So in order for that to happen, you have enzymes that break those bonds, and it turns out that zinc and copper are important in those as well. In terms of the antioxidants, I think the biggest thing is that anytime you have a high metabolic rate, we know that free radicals are formed at a higher rate. This has been studied a lot in muscle. If you have a sedentary horse versus a horse that's really working, we know that the dietary recommendation for vitamin E goes up with exercising horses. And the reason is exercise burns oxygen and creates more free radicals. So free radicals, we know about, we think about skin and free radical damage, but ultimately free radicals damage fats, proteins, and DNA. All of those things are critical for cell health, right? So the antioxidants work in different ways depending on the different types of oxidants, the different types of free radicals. There are different types of either enzyme-related ones or vitamin-related ones, and they're actually interrelated. They help each other out. Vitamin C helps to reinvigorate vitamin E after it's done its job. So those are really important for just overall cell health. Biotin is the ingredient that gets the most play, and it really has been studied a lot, and it really is an important ingredient. What I would say though is that if we just say, oh, there's a hoof problem, give them biotin. To me, that's a little bit short-sighted, because what we don't know is, do we have deficits in any of these other areas? Are there amino acids, the sulfur containing amino acids? Do we have enough of those to do the job? Do we have enough fatty acids? Do we have enough of these provitamins? All of those things together. Selenium's another one. Selenium is very important for all types of muscle, other enzymes, and we know that that's a trace mineral that is reflected in the hay. So the soil where hay is grown, if it's low in selenium, then the hay is low in selenium. There are a few places where it can actually be high in selenium. And we know that that's a mineral that has sort of a narrow therapeutic windows, the fancy way of saying where we want that level to be, where the selenium, if it's low, you can have bad hoof quality. If the selenium is high, you can have bad hoof quality. So that's one of those things that is worth looking into if there is a problem, because that can be supplemented separately as well. But ultimately, I guess, to make a really long story shorter, is that relying on one ingredient as the silver bullet is rarely the right choice, unless you know there's a specific deficit. Um, in general, for hoof health, for me, I want to have all those ingredients ready to go when those really active cells are building that hoof. If they're not, what you'll see, say, when a horse has a fever, is they'll have a fever line that grows down, and that's where the quality of the hoof was not as good. So that's kind of a starker example. But if you imagine that there are sort of weak spots that grow along as that hoof grows out, and from the coronary band down, it's a year, at the toe. So to me, having the right mix of ingredients available 24/7 is kind of the recipe for success.
Yeah, I love that. And the nutrition is something that, we know in our world you can't compromise on it. It's such a very valuable piece of the equation and in overall equine health, but certainly in helping to maintain a healthy state. You don't want to deal with a lot of these problems, and it's not that nutrition can be the magic bullet in and of itself, but it's certainly an important piece of the equation. And I want to get Lee's take on it real quick as well, because one of the ways that we met Lee Olsen was that we kept having clients call us and say, hey, there's this big time farrier in Texas, and he talks a lot about nutrition. I think you guys should talk to him and hear what he has to say. And so we've talked to him and we've heard what he has to say. We really like this guy. But Lee, share a little bit about that and why you are and have been a believer in nutrition in terms of the cases that you see in your clients.
So a lot of people get really caught up in hoof growth. I just want to say, what is the point of bad hoof growth, right? So we need quality hoof growth. And just like Matt was talking about, so a healthy hoof rarely has problems. You know where an abscess breaks out? At the worst part of the foot. Wherever a quarter crack is going to come out at the worst part of the foot. So wherever there's an issue, there's going to be a bigger problem, right? You can get rid of all of that by having a healthy hoof capsule. And I believe in just the regular platinum work does wonders on its own, but the hoof support does very well through platinum. I feel like that I've been approached by so many supplement companies, and I feel like it's crazy, because you have to think about it as a horse owner. I love horses, and you're going to be putting stuff into their body, and these horses are typically worth more than our houses, and you're going to save money on the supplement. Like, I want something that's researched. I want something that's proven, not something that I'm going to save $20 on or whatever. You want You want to go with results, and you're messing with a year to grow a horse's foot. I mean, that's nothing to mess with. So you mess this up, you're going to set your horse back for potentially a year, or wonder why his feet are falling apart, or why this problem in his hoof came back. Maybe it's a shoer, maybe it's not. Maybe it's because he's got bad feet and you got off of platinum.
Well, thank you for that, Lee. No, and obviously we believe in it. That's why we do what we do. And we believe that nutrition can help maintain a healthy horse, but it can certainly help be a complementary tool that can be used, whether by your farrier, by your veterinarian, in conjunction with a lot of other important interventions, when there is a problem with the horse. So I want to thank both these guys that have been with me today. And I knew at the beginning when we said, hey, we're going to keep this brief and 30,000 foot view, that the three of us would be completely incapable of doing that. But I applaud us all for doing our best. Thank you to both Dr. Durham and to Lee Olsen. And I really encourage our listeners to go and find those podcasts. They're easy to find on Apple and Spotify, and also on the Platinum website, including the articles as well. If you do want to dive a little bit deeper into laminitis, into navicular syndrome, into the nutrients that support the hoof, it is all there for you. So happy learning. And we certainly appreciate you all joining us on the It Starts Within podcast. I am Jessie Bengoa, and until next time, take care, everyone.